Good morning, everyone. It's Charlie. It's been a bit while. I ran into a couple little complications, but I'll explain here shortly. But the surgery went well. Back on February the 2nd. We did have some footage that we shot that morning. Val shot a bunch of footage from leaving the house and driving over and going into the hospital. Now, you know, with the Patient Privacy Act, if you notice, I go out of my way to make sure there are no patients or no one else in the footage that I shoot, other than those who say they want to be in it. I've done a couple of interviews with folks at the hospital, but they're off to the side of the camera. But anyway, it all started on February the 1st when I went for my pre-op exam, where they take your blood pressure and all that and ask you all these questions. And I told them what I was doing, that I said, I'm going to shoot some footage. I said, tomorrow, I said, I want to shoot this all the way into the pre-op area, and I said I need a release. I need you guys to give me a release. And they said, well, I don't know about that. We'll have to. I said, well, I'll tell you what. If you don't give me the release, I'm not doing the surgery. Simple as that. So I don't know whether that was a threat to them that they thought to take serious or not. But anyway, I left and just said, okay, well, we're going to shoot. The next morning when we get to the hospital, the reason for the delay is that in doing this is this stupid tickle cough that I've developed after the surgery. And I developed it after we did the surgery on the right lung too. But good old Tim Hortons coffee, nice and hot, helps a lot. So anyway, so that morning we're on our way and we're walking into the hospital, and my cell phone rings. And this individual introduced herself on the phone and said that wanted to know what we were doing, that wanted to do some filming in surgery. I said, no, I just not want to do, I'm not going into surgery to do filming. It's all the way into the pre-op room. And I said, and after my surgery, when I'm well enough, I'll pick up and I'll shoot some more footage and we'll tie it all together as pre and post. Oh, we continue on our way, and Valerie is shooting video, and we get into pre-op, and there's people in there that want to know what we're doing or whatever, and this is just mine. This is personal. This has nothing to do with you guys. And so anyway, so I'm there in pre-op, and Val's out in the waiting room, and Pastor Claire Chance was there, and she came in with me, and she never mentioned anything that was going on. But security showed up, and they actually twice. Well, that's true, twice. And thank you, dear. And they asked her about the videoing, what she was doing, and they said, where's this film crew? And Val pulls out this Sony and said, this is my film crew. Well, you can't go into the operating room. We have no intentions of going in the operating room. The head of chief surgery called over to Dr. Herrera's office and said, what's going on here? What's with this film crew? Anyway, we did a...
They got the word. It went back to them that we were going to be taking a film crew in, and we were going to be filming the surgery.
True, yeah. But all we were trying to do was just do this documentary. That's all. Nothing to do with the film crew. But anyway, the February 2nd, the surgery went on, and God love them, the whole crew of Lowe's from District 858, which is my district here in Central Florida, and headed up by Dan Brown, who's the district manager, all were wearing Charlie's cancer awareness Cancer Sucks TV bracelet. And for that I thank them.
And blue.
And this, yes, everybody was in blue. They all, because blue is one of our colors at Lowe's. So a lot of folks, well, here's one here. Now, this is store 2652. They took some pictures. Matter of fact, that same store created an album for me, which I thought was just awesome. You know, the fact, just everybody there thinking of, waving up to Charlie. But that's cool. Thank you, guys.
They took National Dress in Blue Day a month early in Charlie's honor.
That's true. The National Dress in Blue Day was March the 2nd. And because Dan said that because I was having the surgery on the 2nd, we were going to do it twice, March the 2nd and February 2nd. So, and the mayor, county mayor, Teresa Jacobs, for March the 2nd, read a proclamation. If you looked at it, that footage is already on the blog, on the website. But God love her, she presented that and said that we touched her. Her and her husband, she made in her part of her presentation of the proclamation, said her and her husband were both going to have a colonoscopy. So that's 2 more people that I got. And the whole thing from this blog, from start to finish, and our plans to travel across country on Route 66, is all just to make sure that we can talk to folks and say, colonoscopies. Have a colonoscopy, it'll save your life. It can save your life.
Just found out one man from church just had one.
That's true. This a friend of ours
from church. His 5 years.
Yep, his time was up to have it done, and did it, and they found something, and next week he's going to be having surgery, and to remove it. Simple as that. Saves your life. So kind of everything saves your life. My assistants back there, they're trying to put the cue card up. What's that? What'd that say?
8 minutes.
Oh, 8 minutes. We're into 8 minutes? Oh, okay. I have to keep this low because we post this on YouTube before it goes to the blog. So anytime that you want to see anything that we've done, just pull up Charlie Awad on YouTube and you'll see all the previous work that we've done. The scheduling of the trip across Route 66 for May the 20th, we were going to do that, and that's not going to happen. I'm not going to say that it's not going to happen, but it's not happening on May the 20th. Sorry to say. With the country in a recession, I'll say it's in a recession, that it's hard to get sponsors, and I just don't have the funds to do it. It would be great. It would be great to document it. It would be great to talk to folks. It would be great to get more people to going and having colonoscopies. What did Sharon say to her husband, Ozzy Osbourne? Asked him what his dream is, his biggest dream. And he said to fly to New York and have a colonoscopy. That's part of a program that CBS has that's called CBS Cares. I don't know if anybody's won it yet. But anyway, that's where we are. Just
the car.
That's true.
How far is the car?
Yes. I don't have it. Well, you've got a couple of pictures.
I'll
you may
post
get
pictures.
There's a couple of pictures. The 50 Dodge Needed more body work than we thought, and God love the folks down there at Feld's Body Shop doing all the work. The car is painted all white now.
It looks like an angel.
It looks like an angel, and they're ready to put the blue on. So this week I'm hoping that they're going to do that, because there is other work that needs to be done to the car. But we're still doing it step by step. I haven't put a date to it yet, but the May 20th is going to get moved to somewhere nearer the 1st of September. We need to do it when the weather is on our side too, because I don't want to be in a rainy season, I don't want to be in the cold season. But that we're going to leave Chicago and drive straight across Route 66, stopping in every state, hopefully documenting and talking to folks about colonoscopies, and talking to patients who have developed colon cancer, talk to caregivers who have supported their loved ones who have the colon cancer. That'd be beautiful. I'd be able to document all that. Anyway, I'm getting the high sign that I have to sign off. So this is Charlie for now. Sorry it's taken so long to get back. Till we talk again. Take care. Hi there, it's Charlie again. I want to talk to you about, oh golly, how do I put this? Mistakes that happen, and what the results from those mistakes. You know that I had the surgery on February the 2nd, and as always, they'll take whatever tissue there is that's damaged, or in this case the cancerous tissue, and they send it off to a lab up in Pennsylvania. Now, it takes a while. It takes a few weeks, because they're going to take tissues from that cancer, and they're going to put it in a pea dish, and they're going to try different types of chemo to see which is most effective in killing it. Now, mind you, that's still live tissue. And I went back to to see Dr. Herrera, who was my thoracic surgeon who did the surgery on my lung, and we're looking for the results. And we look at the results, and there's nothing on there that says they're all non-responsive. A couple were intermediate, but as far as for a responsive chemo treatment, there was nothing. Why? Because they took that tissue and treated it for lung cancer. The report came back, and they said in the report that the specimen was for colon cancer, but the specimen was retrieved from the lower lobe of the left lung. Now, doing checks and balances per se, nobody looked at it and saw that nothing was responsive. What's wrong? You see, with different cancers, whether you have prostate cancer, colon cancer, lung cancer, liver cancer, they just don't give a chemo to it to kill it or to stop it from growing. Everyone is different. Now, that's something that I was all overly aware of, but when it came back and they were treating it for lung cancer, there was nothing there that they could see that would kill it. Then anyway, they sent it back. So the doctors reported back to them, said, listen, hey, you need to redo that. This gentleman doesn't have lung cancer. He has colon cancer. It just so happened to land in his lung. So I called back to the doctors I think on Monday, giving them time to call the lab, and I was informed that yes, the lab was going to redo the test properly. Well, 2 weeks later, we're looking for results back, And I go to the doctor, and then I'm informed that the lab didn't keep any tissue. They should have taken what was left and they froze it for any future testing, but they didn't do that. So now I'm in a situation of sit, drink my coffee, and wait. I discussed this with my oncologist, and he said, Charlie said, I don't know what to give you. I don't know what to do.
He was beside himself. That was
Yes.
the last news after all of this from 2004, out of all of this, to finally be stopped dead in our tracks because they mishandled the tissue.
Because they messed up the lab work and threw the whatever tissue was left, discarded it. So all we can do now is just reach into a hat and dig around and pull out something and say, okay, let's try this. This is good for your bunions. We'll see if that'll work. Doesn't happen that way. That's not what works. You know, that's what actually worked on that tissue. Anytime that you have surgery in cancer, and they go to find out what type of chemo to give you, there's some pre-testing that has to be done, either to the tissue or through the blood. So now I'm in a situation of, we're going to wait 3 months, and then we're going to do another CAT scan with contrast and see if any cancers come back. Then we're going to wait another 3 months, do a CAT scan, and see if any cancer came back. I'm actually stopped. There's nothing else that I can do at this point. There's so many side effects. Either with neuropathy, it's one of the hardest things that I've had to deal with, or the fact that your hands and the bottoms of your feet peel. The skin actually peels off. One chemo that I was taking, I had no, I could have been a safe cracker because I had no fingerprints, no distinctive markings on my fingers. Which is a shame, and that's, you know, I don't know how you make these people feel accountable, or what you do to them. You know, I'm still undecided what I want to do in this. I'll be quite honest with you. I'm not looking for anything as far as for a financial gain, but by golly, somebody's got to be responsible for checks and balances. At the bottom of that report that came back, a doctor signed his name. A doctor who was in charge of all the tests at that facility. Now that's more than enough for one person, but you know, if you put a piece of paper in front of you and you're willing to sign it without reading it, I got some blank checks here that I need you to sign. It's not right. They should have immediately caught that, corrected it right then and there, nip it in the bud. But no, somebody just signed it, sent it on. That's irresponsible. And I don't want this to happen to other people. These laboratories and these testing facilities need to be forced to stand up and take responsibility for their job. You're given a job to do. I don't care whether you're out there digging ditches. You got to.
It's life and death.
Well, in this situation, it is life and death. I'm still alive. But I don't have anything that I can take now that's going to advance that or prevent anything from coming back. I have to sit and wait until something else comes back. I don't have any more damaged tissue right now. So anyway, I'm undecided, but by golly, that's another plate that I'm on. I want people to get colonoscopies, and I want these labs to stand up and take responsibility for their job. Anyway, I'm going to be off my soapbox right now because they're giving me the high sign that I'm running out of time again. I just seem to want to ramble here. But we will post this, and along with the other videos that are upcoming, and we'll bring you updates of what's going on. Anyway, in reference to the journey of Charlie and Cancer Sucks TV. Bye.